So today we are going to talk about reactive arthritis. Reactive arthritis. Okay. So it is a form of spondyloarthropathy, and it is triggered by some infections like GI infections, like there may be Salmonella, Shigella, or chlamydia infections. I mean to say that genitourinary infections. So it is basically an inflammatory arthritis. When you aspirate synovial fluid from joint, you get negative bacterial culture. I mean to say that you won't see any bacteria in synovial fluid, but there are markers of inflammation in synovial fluid. For example, you may be see elevated neutrophils. That why it is called sterile. Okay, it means there is no bacteria, but there may be there is increased inflammation, and it is post-infectious arthritis, and as the name suggests, it is just reactive. So it is a form of reaction, autoimmune reaction. Okay, and only 30 to 50% of patients with reactive arthritis are HLA-B27 positive. So let's write down, only 30 to 50% of patients with reactive arthritis are HLA-B27 positive. It means not all patients are positive, only about 30 to 50%, and testing for HLA-B27 may assist with diagnosis of reactive arthritis in indeterminate cases, but the marker is neither sensitive nor specific. Okay, so in indeterminate case it helps in the diagnosis, but this marker is neither sensitive nor specific, and no bony joint abnormalities are seen on X-ray of affected peripheral joints in acute reactive arthritis. So if you do X-ray, there is just inflammation, so you don't see any specific change in X-ray suggestive of reactive arthritis. It is just inflammatory changes. You can see some swellings like that. Okay, otherwise there is no specific signs in X-ray. And calcaneal spurs. Calcaneal spurs may be seen with enthesitis. So you know calcaneal spurs. If you don't know, you can Google it about calcaneal spurs. And in rare cases, sacroiliitis may be present with axial joint involvement. Okay, and it is in rare cases. In sacroiliitis may be present with axial joint involvement, and Achilles tendinitis and plantar fasciitis occur in up to 90% cases. So since it occurs in 90% cases, let's write down Achilles tendinitis and plantar fasciitis occur in 90% cases. Okay, and dactylitis can also occur. Dactylitis can also occur in reactive arthritis. In about half of patients, symptoms self-resolve within 6 months. In 50% cases, symptoms self-resolve within 6 months. Okay, about half of patients, and most of the cases self-resolve within a year, and most of cases self-resolve within 1 year. Okay, and with a small proportion converting to chronic disease. So prognosis is good. In majority of patients go into a spontaneous remission within 6 to 12 months of onset of arthritis. However, some patients have persistent but mild musculoskeletal symptoms, and others develop radiological evidence of joint injury and evolve to a more chronic form of spondyloarthropathy. So now let's move to treatment. So we don't give antibiotic unless there is active infection. So since most patients have self-limited disease, short-term use of NSAIDs, short-term use until condition self-resolve, we give symptomatic treatment for pain. Okay, and if relief is incomplete, then intra-articular glucocorticoid injection, intra-articular steroid injection, and oral glucocorticoid can be used. Okay, and if symptoms persist beyond 3 to 6 months, then use of DMARD may be necessary for symptom relief. Okay, to prevent joint erosion as well, and therapy is discontinued 3 to 6 months following disease remission. Therapy is discontinued 3 to 6 months following disease remission. Okay, so that's all about reactive arthritis. If you want to take note of anything, you can take it. I am adjusting this camera. Okay, that's all.